Hello and welcome friends. Today we will be continuing in the same topic, that is the injury, and we are in the regional injuries, that are basically injury to the uh, cavities like head injury or injury to the thorax and abdomen. We will be having a discussion on the injury to the thorax and abdomen, and we will be discussing about the chest injuries, injury to the heart, into injury to the uh, to lungs, aorta, and the underlying structure, and we will be continuing in the same fashion about the same manner about the abdominal injuries, injuries to the liver, spleen, stomach, intestine, kidneys, and other. Then we will be discussing about their importance and the relevance. Chest injuries is basically can be sustained either in the chest wall or to its contents lying inside it. Chest wall injury is very important because it is a chest is a cage in which the lungs basically expand and collapse, expand and relax, expand. In like we have inspiration and expiration. So in inspiration, the lungs expand, and in expiration, lungs shrink. So if this cage and the pressure is being released to us somehow because of the injury to the ribs, or there is an open injury to the chest wall, then the dynamics of the breathing changes, and along with that the lung volume changes, along with that the heart pressure changes, and the various things happen. We will be seeing into the coming slides. The anatomy, which is very much important, where the underlying structures are lying. Relationship of visceral content to the external landmark, we will be noting that in the next diagram. Describe the reference to diagrams, relationship of pleural cavities and the lungs, heart, mediastinum, and diaphragm. So we will be having a diagram which will depict from the what are the things that are underlying. This is the rib cage. Along with that, we can see there is a heart lying inside, there is a lung lying inside, there are the various vessels which we can see that internal carotid artery, external carotid artery, this is the internal jugular vein, then subclavian artery, then heart, right lung, left lung. We can see in the coming slide we will be seeing about the various structures lying here also. But we can see there is a lower border of the lower edge of the lung is lying up to 6 rib, and below that there are other things that can be, but pleural cavity limit is about 9th rib. This is the pleural cavity rib. So lung is lying little higher, then the pleural cavity is at the lower level, and the lung expands and go up to that level, and the air come inside the chest cavity. Similarly, when the lung exhales, the lung shrinks and expels the air out. From the forensic aspect, spleen, somewhat of the spleen, liver, and the stomach, maybe spleen and stomach lying here, liver lying here. So we will be having anatomy of that also, and the injuries that may be in this space or in that space can cause the injury to the abdominal structures as well as the chest also, or the lungs. So it can be overlapping, and we should keep in mind that the thoracic organs, they lie largely beneath the costal margin. These organs lie just below the costal margin or somewhat overlap the chest cavity. So they are vulnerable for stabbing or blunt injury. If the injury is happening in the chest cavity, if it is there, then some of the organs like liver spleen, stomach, they are lying here. So if a injury is happening like this, it can penetrate the spleen, it can penetrate the liver depending upon the direction of the weapon. This is another diagram which shows the overlapping of the different organs. Here we are having carotid artery, subclavian artery, axillary artery, then the heart is there, which is just overlying the sternum and towards the left side. Rib cage is there, we can see the numbering is there, 1, 2, 3 up to 10, and aorta which is coming downside, kidney is attached to that, right kidney, left kidney, spleen, and the dissection and bifurcation of the common celiac arteries that they supplies the lower limb. So we should be having a complete knowledge of the anatomy and the underlying structure lying there, so that we can have complete orientation of the organ which may be underlying and the injuries that can happen because of the overlaying of the organs, so that we can interpret according to that. Penetrating injury, especially by knife to the lower lateral wall of the thorax, can cause the injuries to the liver or the stomach or the spleen, may enter the peritoneal cavity as well as the pleural space. You can go in both spaces. Diaphragm can be in line also, stomach can be in line, it can reach up to the heart. So all the organs, by a stabbing wound of a knife or stabbing wound of a bullet, can penetrate or travel in any of the direction depending upon the position of the body and the direction of the weapon. Injuries to the chest wall, it is very common and very common phenomena, and person may die because of that. Injury can be compromised either by severe mechanical failure of the rib cage, like crushing injuries or running over of the vehicle, or by penetration of the pleural cavity. Somebody is just stabbed something in the intercostal spaces, and there are chances that it can penetrate the pleura. So the pressure of the pleural cavity is being released and the dynamics of the lungs and the heart changes. I will tell you in the coming part. Fracture of the wrist are common, but do not greatly embarrass the respiration. Fracture of rib is very common, but generally it is within the fibrous tissues and the covering around it, but it may penetrate if there is a something which is a veggie which comes out from the rib line and penetrates the pleura. Then the chances are that there are change in the dynamics of the pleural cavity. Like broken end penetrates the pleura and lung. Pleura and muscular plane limit respiratory effort. Respiratory effort is totally a phenomena of closed chamber being pulled up and down, and if any disturbance in that, the negative pressure which is in the cavity, pleural cavity or the chest cavity, can be disturbed. Flail chest, it is another phenomena in which the ribs are fractured at multi sites, like it can be fractured at two places, multiple fracture of some of the ribs, sometimes with added fracture of the sternum. So that part which has been fractured, it becomes mobile. That mobility disrupts the whole cage phenomena. Chest is a cage. Chest is a cage of sternum, ribs and the diaphragm here. Chest is a cage. If something happens, fracture is there, then the cage is disturbed. Then the cage is disturbed, then the phenomena of respiration also disturbs. So, expanding thoracic volume during inspiration as impaired. So, in inspiration, the whole negative pressure will not be maintained. So, the whole pressure changes happen. We will see in the coming slide. The loose section is sucked inward during inspiration. This loose section, which may be loose here or fracture is here, loose section will be sucked inward during inspiration. This clinical sign is known as paradoxical respiration, and dyspnea and cyanosis may develop. Death because of the progressive hypoxia. This is the inspirational phenomena, the rib during inspiration. This whole part is expanding. This part which is broken, it is not expanding, is good inside in inspiration. Whereas in expiration, this whole part is shrinking and this part is coming out. So it is a reverse of the normal phenomena, that is, it is called as paradoxical breathing. This is, you can see the dynamics. Here the fracture is there. So during inspiration, the whole of the air is going this side on, and where the fracture is there, because it is not as strengthened as like this, so it will be sucked, and there are chances of compression of the lung on this side, and the expansion is there. And the reverse happens here in the expiration. This bulges out again, and instead of going air outside, some of the air may accumulate here. This phenomena can go on and sometimes lead to the complete collapse of the lung, and there are chances of dyspnea and death also. Flail chase is caused by frontal violence, sometimes punching or stampede, vehicular run over. Stampede means somebody has fallen and people are running over him or her and crushing the rib cage. Sometimes it happens generally on the railway platform, sometimes in the rallies, or sometimes any of the violent crowd, or where a lot of people are there and somebody has fallen and everybody just keep on going crushing. Chest injury, broken ribs and may be displaced inward, that I have already discussed, displaced inward. Jagged up tips ripping the pleural parietal and the visceral pleura. And this may cause pneumothorax, hemothorax, or both. Rare in civil practice. Generally, it is not common in civil practice, but it is generally common in battle casualties, because of in battles we have bullets. Bullets generally penetrates the rib cage and the cavities and cause laceration. So this pneumothorax and all develop in the battles or the wars easily because of the bullet injuries. Rib fracture most common in the anterior or posterior direction, like this. Anterior and posterior direction most common, because person is lying flat, somebody is put the foot on person is lying flat, somebody has put the pressure here, so it will fracture in the same direction. The road traffic accident and the vehicle also run over in the same fashion, unless and until there are chances that there is a gunshot or something else. Most of the chances that anterior posterior direction there is a chances of fracture of the ribs. The upper ribs are less often fractured. Upper ribs are less often fractured. Fractures show bleeding beneath the periosteum. Attempt to resuscitate external cardiac massage in our practice, like reviving a patient of cardiac arrest. There are compressions on the chest so that the heart may be keep on beating and the pumping of the blood can happen. The other side of that is there are multiple rib fractures due to that compressions. In infants, most of the time rib fractures due to child abuse. Infant is squeezed from side to side. So adult's hands are clamped on each axilla or the lower or the lateral side of the chest. Hyperflexion of the ribs sometimes happens and can cause compression of the rib and the fracture there. The ribs are levered against the transverse process of the vertebra by excessive anterior flexion. Fracture in paravertebral gutter. This is the if spine is there, then the ribs are there. Ribs are there. If it is compressed like this, then ribs may or the vertebra can compress and the chances are of overcrowding of the ribs can be found at autopsy or in the radiograph. Fresh fractures on radiography and at autopsy. Within 2 weeks, there is very if we see the healing process in case of a child, the multiple injuries can happen at different times. So we can at 2 weeks we can see callus formation, with that can be visible on the X-ray, then can be visible in the post-mortem. So in case of battered baby syndrome, we can have the rib fractures also, multiple stages of healing of the ribs also, and there are different phenomena at different places which can lead to the diagnosis that the child has been beaten or being abused over a period of time due to multiple fracture healing and multiple fracture levels. This is the fracture of the rib. One line is here and one line is here. This is the anterior posterior phenomena like this, compressing of a child, that can lead to fracture and can also lead to flail chest and other phenomena. Anterior rib fractures are rare in infancy other than the child abuse. Bony injury in resuscitation attempt in case of infants. Infant older fractures due to birth injury may be found. Sternum may be fractured due to stamping, frontal impact, posterior displacement of the fragment or heart or greater vessels may be severely damaged. If a rib fracture is there and there is much penetration deep inside, then there are chances that there is a rupture of the heart or the great vessels. So we should be very much conscious, very much aware about the internal anatomy of these structures lying or internal organs that are lying, because rib fracture can penetrate and cause the injury, and that can be a fatal injury also. Hemorrhage and infection in the chest. When the rib cage is disturbed, fracture of the ribs, then it can penetrate the pleura and can cause the infection along with it. Intercostal and less often mammary arteries are affected, or it can lead to hemothorax. The mammary arteries and the intercostal arteries can be ruptured along with the ribs. Massive hemorrhage can be there. Large volume of blood can be accumulated in the lungs or the mediastinum. Lung hilum can be torn or penetrated by stab wounds. Several liters of blood may accumulate in the chest, either in the liquid or the clotted form. Mixture of blood can be there. Death may occur from the loss of circulatory blood vessels. So, in chest injuries, there are chances that the great vessels are there, the multiple vessels are there, they can be ruptured because of the rib cage damage, and they can lead to hemothorax and that can compress the heart and the other structures lying there. A knife that passes obliquely into the chest may puncture. If a knife is passing obliquely in the chest from lower to upper or upper to lower, then the great vessels can be damaged, heart chamber can be damaged, or there can be accumulation of the fluid in the pericardial sac, that is called cardiac tamponade or hemothorax. Cardiac tamponade means accumulation of the blood in the pericardial sac. The valve-like overlap of the tissue after withdrawal of the blade may seal up the external wound. It happens generally on the left side of the heart, because left side of the heart is having left atria, left ventricle is having thick wall, so it can auto seal it, but may not auto seal it, depending upon the injury, depending upon the depth of the injury, depending upon the depth of width or force of the weapon. Same may apply to the gunshot wound, where the bleeding can virtually be absent in the wound is generally has not penetrated deeply. Pneumothorax, there are different types of pneumothorax, which is a pneumothorax basically is the accumulation of the air in the pleural sac caused by entry of air into the pleural sac, leading to sudden increase of intrathoracic pressure. It leads to the increase in the pressure of the thoracic cage. Blunt chest injury can happen, and that can lead to that. Sharp penetrating injuries can lead to that. Fracture of the rib can penetrate to the pleura and can cause the accumulation of the air, that, or stab with a sharp weapon. These all can lead to a phenomena, that is accumulation of the air in the thoracic cavity, and that can lead to increased pressure of the thoracic cavity, and that can lead to less expansion of the lungs. So overall, pneumothorax leads to the hampering of the respiration process. There are generally three types of pneumothorax, which we can see it: closed pneumothorax, open pneumothorax, and tension pneumothorax. Closed is by air has entered, and once air has entered, it is there and no further entry is there. So air can enter there, remain there, and can be absorbed. It can lead to partial collapse of the lung bronchus can rupture, or any one time air is there. Here the amount of air entering the pleural cavity does not increase with time. So a particular level of compression will be there, and after some time that air can be absorbed and lung can become normal. In open thorax, the continuous to and fro movement of the air is going on. Air circulates freely through the chest wound. If there is a chest wound, air is going inside and coming outside freely without any obstruction. So there will be a slight compression of the lung on that side. In case of tension pneumothorax, means with each inspiration there is an increase in the air in the chest. So air is generally going inside, not coming out, only inside. With each inspiration, air is going inside, and there is a auto seal mechanism, valve mechanism developed, and it doesn't come out. So with each inspiration, the lung base will collapse, and chances are that the other lung will also not expand, and the patient may die due to increased chest pressure and less expansion of the lungs. A simple type, where the leakage through the pleura allows air to enter the pleural cavity, where the communication rapidly closes, lung partly collapse. If death does not supervene, the air is soon absorbed. This is the first type I discussed. If the communication remains open, then the bronchopleural fistula ensures with the air in the pleural cavity, as it is not under pressure. Not a bubble out of in the autopsy. when we can generally see how the if there is a air is accumulated in the chest cavity, just by putting the lung chest wall inside within the water, and we just cut and we just try to observe the air bubbles. If air bubbles are there, then chances are there that there is a pneumothorax. In radiology, we can find the air within the chest cavity. When the leak is in the pleura, have a wall-like action, air is sucked into the pleural cavity at each inspiration but cannot escape on expiration. This phenomena is known as tension pneumothorax. Complete collapse of the lung can happen. Shift of the mediastinum to the opposite side. Pneumothorax that may be demonstrated at autopsy by penetrating in the intercostal cells. We penetrate scalpel into the chest cavity, the air bubbles come out, and that can be demonstrated through the passing it through the water. Though in radiology we can see that there is a air inside the thoracic cavity. When an injury of the chest wall communicates with the pleural cavity, a sucking wound may form with direct passage of air from the exterior, often seen in the military, complicated by hemorrhage and infection. There is a complete communication between the air and the air or the lung within the chest cavity, and with each inspiration or expiration, the air is going inside and outside. Stab wound of the chest that allows direct communication with the exterior. Same thing happening here. Layered skin or intercostal muscle close the tract when the weapon is withdrawn. The knife often enters the lung. Air can enter the pleural cavity from the bronchi. Natural diseases can also cause the pneumothorax, which like emphysema or other bleeding disorders, other bully formation, adhesions can lead to pneumothorax. A ruptured emphysematous bulla, tubercular lesion, or tear in the site of fibrous pleura, these all can lead to pneumothorax. These are the non-injurious phenomena, whereas the previous discussed things are injurious phenomena which can be caused by someone. This is the disease or the things person is carrying, and it can happen anytime during his lifetime. So it is a diagram which can clearly tell there is a punctured lung because of the penetration, punctured chest wall because of the penetration, barotrauma due to decompression, some fracture is there, then the bursting of the bulla, this is the internal phenomena due to disease. Blast injuries, we will be discussing in the blast injuries that can lead to damage to the chest wall or chest or the lung. Torn pleural adhesion, if there is a adhesion, then the chances of it can be torn out, or there are abscesses of the tuberculosis that can lead to communication of the alveoli to the pleural cavity. These all can lead to increase in the chest cavity pressure or thoracic cavity pressure.